Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Ponsegromab for the treatment of cancer cachexia. Background. Cachexia is a common complication of cancer and is associated with an increased risk of death. The level of growth differentiation factor 15, GDF15, a circulating cytokine, is elevated in cancer cachexia. In a small open-label, Phase 1b study involving patients with cancer cachexia, Ponsegromab, a humanized monoclonal antibody inhibiting GDF15, was associated with improved weight, appetite, and physical activity, along with suppressed serum GDF15 levels. Conclusions. Among patients with cancer cachexia and elevated GDF15 levels, the inhibition of GDF15 with Ponsegromab resulted in increased weight gain and overall activity level and reduced cachexia symptoms, findings that confirmed the role of GDF15 as a driver of cachexia. Levofloxacin for the prevention of multidrug-resistant tuberculosis in Vietnam. Background. Prevention of drug-resistant tuberculosis is a global health priority. However, trials evaluating the effectiveness of treating Mycobacterium tuberculosis infection among contacts of persons with drug-resistant tuberculosis are lacking. Conclusions. Although the incidence of tuberculosis was lower in the levofloxacin group than in the placebo group at 30 months, the difference was not significant. Ebola Outbreak Response in the DRC with rVSV-ZEBOV-GP Ring Vaccination. Background. At the beginning of the 2018 to 2020 outbreak of Ebola virus disease, EVD, in Eastern Democratic Republic of Congo, DRC, no vaccine had been licensed. However, cluster randomized evidence from Guinea in 2015 had indicated that ring vaccination around new cases, targeting contacts and contacts of contacts, with the use of single-dose live replicating rVSV-ZEBOV-GP vaccine reduced EVD rates starting 10 days after vaccination. Thus, ring vaccination was added to the standard control measures for that outbreak. Conclusions. Non-randomized evidence. Regarding standard EVD control measures plus ring vaccination in Eastern DRC, reinforces the earlier randomized evidence from Guinea of vaccine efficacy against EVD onset 10 or more days after vaccination. Twice yearly Depemokimab in severe asthma with an eosinophilic phenotype. Background. Depemokimab is an ultra-long-acting biologic therapy with enhanced binding affinity for interleukin-5 that may enable effective 6-month dosing intervals. Conclusions. Depemokimab reduced the annualized rate of exacerbations among patients with severe asthma with an eosinophilic phenotype. Next, we will be discussing articles from Journal of American Medical Association. 2024 update of the Recover Adult Long COVID Research Index. Question. How do updated data from nearly 4,000 additional participants and expanded symptom questionnaires inform the prior research classification for long COVID, LC, or post-COVID-19 condition? Findings. In this prospective observational cohort study, data from 13,647 adults participating in the Researching COVID to Enhance Recovery Recover Adult study were used to update the research index for classifying symptomatic LC and 5 symptom subtypes that differ in associated demographic features and quality of life, meaning the 2024 LC Research Index may help researchers identify people with symptomatic LC and its symptom subtypes. Refinement of the index will be needed as research advances and the understanding of LC deepens. Next, we will be discussing articles from Annals of Internal Medicine. Impaired WNT/planar cell polarity signaling in yellow nail syndrome. Background. Yellow nail syndrome, YNS, is a rare disorder characterized by a triad of yellow dystrophic nails, lymphedema, and chronic lung disease. Most patients present in adulthood, with only a few congenital or familial cases described. The cause of YNS remains largely unknown, although defects in lymphatic vessel development are suggested to play a significant role. Objective. To elucidate the genetic mechanisms underlying YNS. Conclusion. Defects in PCP organization may play a major role in the pathogenesis of YNS. To the author's knowledge, this is the first demonstration of a mechanism explaining YNS development, mainly in its congenital form but also in patients with sporadic disease. Next we will be discussing articles from British Medical Journal. Christmas 2024, Age Against the Machine, Susceptibility of Large Language Models to Cognitive Impairment. Objective: to evaluate the cognitive abilities of the leading large language models and identify their susceptibility to cognitive impairment using the Montreal Cognitive Assessment (MoCA) and additional tests. Conclusions. With the exception of ChatGPT 4o, almost all large language models subjected to the MoCA test showed signs of mild cognitive impairment. Moreover, as in humans, age is a key determinant of cognitive decline. Older chatbots, like older patients, tend to perform worse on the MoCA test. These findings challenge the assumption that artificial intelligence will soon replace human doctors, as the cognitive impairment evident in leading chatbots may affect their reliability in medical diagnostics and undermine patients' confidence. Next we will be discussing articles from Lancet. Global, Regional, and National Progress Towards the 2030 Global Nutrition Targets and Forecasts to 2050. A Systematic Analysis for the Global Burden of Disease Study 2021. Background. The 6 Global Nutrition Targets, GNTs, related to low birth weight, exclusive breastfeeding, child growth, wasting, stunting, and overweight, and anemia among females of reproductive age, were chosen by the World Health Assembly in 2012 as key indicators of maternal and child health. But there has yet to be a comprehensive report on progress for the period 2012 to 2021. We aimed to evaluate levels, trends, and observed to expected progress in prevalence and attributable burden from 2012 to 2021, with prevalence projections to 2050, in 204 countries and territories. Interpretation. Based on current levels and past trends, few GNTs will be met by 2030. Major reductions in attributable burden for exclusive breastfeeding and anthropometric indicators should be recognized as huge scientific and policy successes. But the comparative lack of progress in reducing the prevalence of each, along with stagnant anemia in women of reproductive age and widespread increases in child overweight, suggests a tenuous status quo. Continued investment in preventive and treatment efforts for acute childhood illness is crucial to prevent backsliding. Parallel development of effective treatments, along with commitment to multisectoral, long-term policies to address the determinants and causes of suboptimal nutrition, are sorely needed to gain ground. Next we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Bladder-preserving trimodality treatment for high-grade T1 bladder cancer. Results from Phase 2 Protocol Energy Oncology /RTOG 0926. Purpose: to investigate the use of radiation with radiosensitizing chemotherapy following repeated transurethral resection, trimodality therapy, as an alternative to radical cystectomy in T1 bladder cancer which has failed Bacillus Calmette-Guerin, BCG. Conclusion. Trimodality therapy is an effective potential alternative to radical cystectomy for recurrent high-grade T1 urothelial cancer of the bladder. At 3 years, 88% of the patients remained free of cystectomy. Next we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Bladder-preserving trimodality treatment for high-grade T1 bladder cancer. Results from Phase 2 Protocol Energy Oncology /RTOG 0926. Purpose: to investigate the use of radiation with radiosensitizing chemotherapy following repeated transurethral resection, trimodality therapy, as an alternative to radical cystectomy in T1 bladder cancer which has failed Bacillus Calmette-Guerin, BCG. Conclusion: trimodality therapy is an effective potential alternative to radical cystectomy for recurrent high-grade T1 urothelial cancer of the bladder. At 3 years, 88% of the patients remained free of cystectomy. Here are the articles from Journal of Hepatology. Type I interferon shapes peritoneal immunity and cirrhosis and drives caspase-5-mediated progranulin release upon infection. Bacterial translocation contributes to immune dysfunction in patients with cirrhosis. Bacterial single-stranded DNA drives type I IFN release and primes peritoneal macrophages. Peritoneal macrophages upregulate IRF1, GBP2/5 and caspase-5 during spontaneous bacterial peritonitis. IFN permits the release of the DAMP progranulin in a caspase-5 dependent fashion. Peritoneal macrophage-derived progranulin associates with outcome in spontaneous bacterial peritonitis. Next we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Spatially resolved niche and tumor microenvironmental alterations in gastric cancer peritoneal metastases. Background and context. Peritoneal metastasis in gastric cancer is an important clinical challenge with limited understanding of its underlying mechanisms. New findings. Our study provides the largest multi-omic analysis of gastric cancer peritoneal metastases, identifying key genetic alterations, tumor microenvironment features, and therapeutic targets associated with peritoneal metastases. Clinical research relevance. Our findings highlight the importance of considering peritoneal-specific molecular alterations and tumor microenvironments in clinical trial design for targeted therapies and immunotherapies in gastric cancer. In addition, the discovery of potential biomarkers and therapeutic targets may lead to personalized treatment strategies for patients with gastric cancer peritoneal metastases. Next we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Impact of intrapartum azithromycin on the carriage and antibiotic resistance of Escherichia coli and Klebsiella pneumoniae in mothers and their newborns. Background. Limited data exist on the effects of intrapartum azithromycin on the prevalence of carriage and antibiotic resistance of Enterobacterales. Conclusions. Intrapartum azithromycin decreased E. coli carriage, but increased both K. pneumoniae carriage and azithromycin resistance in both bacteria. These data need to be considered together with efficacy results to balance the potential short and long-term impact of the intervention. Next we will be discussing articles in the field of rheumatology. Achieving medication-free remission in patients with juvenile dermatomyositis. Objective. Prognostic factors associated with medication discontinuation in children with juvenile dermatomyositis, JDM, remain largely elusive. We aim to identify the predictors of medication-free remission, MFR, in children with JDM. Conclusion. Half of our patients with JDM achieved MFR. Age at JDM diagnosis may be an important predictor of achieving MFR. Next we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Therapeutic effects of heart failure medical therapies on standardized kidney outcomes. Comprehensive individual participant level analysis of 6 randomized clinical trials. Background. Kidney outcomes have been variably defined using non-standardized composite endpoints in key heart failure trials, thus introducing complexity in their interpretation and cross-trial comparability. We examined the effects of steroidal mineralocorticoid receptor antagonists, the angiotensin receptor neprilysin inhibitor sacubitril/valsartan, and SGLT2, sodium glucose cotransporter 2. Inhibitors on composite kidney endpoints using uniform definitions in 6 contemporary heart failure trials. Conclusions. When applying standardized stringent kidney endpoint definitions, steroidal mineralocorticoid receptor antagonists, angiotensin receptor neprilysin inhibitor, and SGLT2 inhibitors have either neutral or beneficial effects on kidney outcomes in heart failure. Applying less stringent definitions increased event rates, but included acute declines in EG-free that might not ultimately reflect long-term effects on kidney disease progression. Here are the articles from Journals of the American College of Cardiology. Hypertensive disorders of pregnancy increase the risk for myocardial infarction, a population-based study. Background: angiographic evidence of the anatomy of coronary arteries and the type of coronary artery lesions in women with a history of hypertensive disorders of pregnancy, HDP, are poorly documented. Objectives: this study sought to determine the role of a history of HDP as a unique risk factor for early coronary artery disease, CAD, and type of acute coronary syndrome, ACS, atherosclerotic versus myocardial infarction with non-obstructive coronary arteries, MINOCA, in women who underwent coronary angiography. Results: a total of 506 Pieris female Olmsted County, Minnesota, USA, residents had incident CAG and angiographic data from November 7, 2002, to December 31, 2016. Women with HDP were younger than normotensive women at the time of the event, median, 64.8 years versus 71.8 years, p equals 0.030. There was a strong association between HDP and ACS, unadjusted p equals 0.018. Women with HDP compared with women with normotensive pregnancies were more likely to have a higher syntax score, OR, 2.28, 95% C, 1.02 to 5.12, p equals 0.046, and MINOCA, OR, 2.08, 95% C, 1.02 to 4.25, p equals 0.044. Conclusions: a history of HDP is associated with CAD earlier in life, and with a future risk for myocardial infarction with both obstructive and non-obstructive coronary arteries. This study underscores the need for timely detection and treatment of non-obstructive disease, in addition to traditional risk factors. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Diabetes Care. Risk of infection in older adults with type 2 diabetes with relaxed glycemic control. Objective: to compare the risk of hospitalization for infection among patients who achieve intensive versus relaxed glycemic control. TONS conclusions: older patients with type 2 diabetes who achieve relaxed glycemic control levels endorsed by clinical guidelines are not at significantly increased risk of hospitalization for most infections, but HbA1c 8% to less than 9% is associated with an increased risk of hospitalization for skin, soft tissue, and bone infection. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Occupational exposure to charcoal smoke and dust. A major risk factor for COPD. Abstract background: occupational exposure to charcoal smoke and dust is a threat to workers' respiratory systems. Research question: what is the prevalence of COPD in charcoal workers compared with that of farmers in rural areas of Democratic Republic of Congo, DRC? Interpretation: in rural areas of DRC, producing or selling charcoal is associated with a higher risk of COPD. Dexmedetomidine for reducing mortality in patients with septic shock. Background: sepsis, especially septic shock, and its complications have been linked to the hyperadrenergic stress response. Research question: does decatecholamine with dexmedetomidine lower the in-hospital mortality in patients with septic shock? Interpretation: the study was underpowered to detect a reduction in in-hospital mortality or norepinephrine equivalent dose in patients with septic shock with dexmedetomidine. However, dexmedetomidine may reduce epinephrine infusion rescue, persistent AF, Apache 2 score, and CRP. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Concordance and prognostic relevance of different definitions of systemic sclerosis interstitial lung disease progression. Rationale. Interstitial lung disease, ILD, in systemic sclerosis, SSC, is a common complication that has a varied progression rate and prognosis. Different progression definitions are available, including minimal clinically important worsening of FVC, U-STAR, European Scleroderma Trials and Research Group. Progression, OMERACT, Outcome Measures in Rheumatology Clinical Trials, Progression, and ERIC-ILD Working Group Progression. Pulmonary function and symptom changes may act as specific confounding factors when applying these definitions in SSC. Objectives. To assess the concordance and prognostic value of 4 different definitions in patients with SSC-ILD overall, and in specific clinical groups. Conclusions. The 4 evaluated definitions of progression in SSC-ILD are not interchangeable, resulting in up to 1/3 of cases being classified differently on the basis of adopted criteria and presenting different prognostic values, particularly within specific clinical groups. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Impairment of cardiovascular functional capacity in mild to moderate kidney dysfunction. Mild to moderate CKD is associated with impairment in cardiovascular functional capacity, as assessed by oxygen uptake at peak exercise, VO2 peak. Cardiac output is significantly reduced in patients with mild to moderate CKD, and is associated with impaired VO2 peak. Assessment of VO2 peak by cardiopulmonary exercise testing can detect decrements in cardiovascular function during early stages of kidney function decline that may not be captured using resting left ventricular geometric indices alone. Here are the articles from Kidney International Reports. Projecting the population-level burden of CKD progression according to urine albumin to creatinine ratio categories. Introduction. Urinary albumin to creatinine ratio, Walker, is an independent predictor of chronic kidney disease, CKD, progression. However, there is limited evidence on the burden of CKD according to Walker categories at the population level. This study estimates future clinical and financial burden of CKD according to Walker categories using the INSIDE CKD microsimulation. Results. CKD populations, diagnosed and undiagnosed individuals, stages G3, G5, were projected to be predominantly within Walker categories A1 and A2 in 2022. Projected cumulative incidence of CKD stage transitions, disease progression, and cardiorenal complications. Heart failure, myocardial infarction, stroke, and all-cause mortality occurred mostly in Walker categories A1 and A2 between 2022 and 2027. Patients in Walker categories A1 and A2, who represent the largest proportion of patients with CKD, were projected to incur most of the healthcare costs associated with CKD management and cardiorenal complications for the diagnosed population, prevalence 2027. Conclusion. This study highlights the disproportionate population-level clinical and economic burden associated with individuals within KDIGO-Walker categories A1 and A2, who represent most of the CKD population. This awareness will help healthcare decision-makers to appropriately allocate resources and interventions to the CKD population, including those with mild to moderately increased albuminuria, to reduce clinical and economic burden associated with CKD.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.